Good evening and welcome to this presentation from the HFA Families Program. I'd like to welcome you. My name is Sandra and I am a program coordinator with Hemophilia Federation of America. Also on the line tonight is Michelle Berg, our programs director at HFA. Just a few helpful hints before we get started. Tonight's webinar will last approximately 1 hour. We welcome your participation and questions. However, your audio will be muted by our webinar system for the duration of this presentation tonight, as it helps eliminate background noise that may disrupt the presentation. If you have a question, we encourage you to use the question box on the right bottom of your control panel. I will then pass these questions along to our speakers. Throughout tonight's presentation, there are several audience poll questions. When the questions appear on your screen, you will have the opportunity to answer those anonymously, and we will then share the audience's feedback. And then finally, we would like to acknowledge Novo Nordisk and AHF for their support of our Families program. And with that, I'll introduce you to our speakers. Julie Piazza is the project manager at the Patient Family-Centered Care and Child and Family Life at CS Mott Children's and Women's Hospital at the University of Michigan Health System. Julie is a certified life specialist for over 25 years, serving both pediatric inpatients and outpatients and their families in a large university teaching hospital. Julie has collaborated with multidisciplinary teams to facilitate patient and family-centered initiatives, hospital and system-wide. Many of these initiatives have been related to reducing pain and anxiety with needle sticks and procedures. An educator for medical and nursing students, Julie is a professor for the Child Life degree program at the local university. Julie has presented at several regional, national, and international conferences for child life, social work, pediatric anesthesia, pain management, quality improvement, leadership, and patient family-centered care. Sandra Merkel is our second speaker tonight. She is a clinical nurse specialist in the Pediatric Acute Pain Service at the University of Michigan and CS Mott Children's Hospital in Ann Arbor, Michigan. Sandra has been a nurse for over 40 years. She graduated from the University of Iowa School of Nursing and obtained a Master of Science degree from the University of Michigan. Sandra is board certified in pediatric nursing and pain management nursing. Sandra has held a variety of clinical and administrative positions and for the past 20 years has focused on pain management. Sandra also participates in and leads in the development of educational programs, guidelines, policy, and evidence-based practice changes. She has collaborated with others in her institution to improve pain assessment and includes non-pharmacological interventions as part of a multimodal plan for pain management. Sandy trained in the full-body enema technique after hearing and reading about its benefits for comfort. She believes that slow, rhythmical movements and a gentle touch can provide relaxation and comfort for both patients young and old. Sandra has presented at several regional, national, and international conferences on pain management, evidence-based practice, and nursing practice policies and guidelines. And with that, I hand it over to Julie and Sandy for tonight's presentation. Thank you, ladies.
Thank you so much, Sandra. It's wonderful to be with you all tonight. And this is Julie, and Sandy is here with me, and we're really excited to be with you tonight and have greetings from Michigan.
And I'm right here with Julie, and it's a pleasure and an honor to be here with you tonight to talk about tackling pain and anxiety associated with procedures. Our focus tonight is not only on tackling pain and anxiety, but to encourage and help you be a coach for your child. Teaching a child how to cope with procedural pain will give them skills that they can use for a lifetime. A coach always wants the team to win, but the lessons learned of how to improve and how to work together are what helps a child succeed in other aspects of life. A coach knows the child, helps them set a goal. A coach also breaks down the activity into steps and helps the child discover what they need to do to solve the problem. As Julie and I talk to you tonight, we'll be focusing on procedural pain. Many of the tips that we share can be used to help tackle ongoing pain from bleeds and other anxiety-producing situations. Like I said before, you can help your child. You can coach them through stress and pain of procedures and healthcare events. I'll start with a quick overview of pain. Pain can be described in a number of ways. For example, My head hurts. This gives a location. My head is pounding and it is severe. That is a description and a level of intensity. All this information is important when planning what to do for the pain. Pain that is short-lived is called acute pain. Pain that lasts over 6 months is chronic and influences the long-term quality of life. Pain is felt when nerves send messages to the brain. Most pain messages are sent over nerves that are intact. The message is that the tissue is damaged and it needs attention. For example, a burn, a surgical incision, a joint bleed. Nerves can be permanently damaged or malfunctioned. Messages sent on these nerves can be difficult to treat. An example of neuropathic pain is feeling your foot being crushed despite it being amputated. It can also be tingling from a pinched nerve in your back or in your arm. These types of pain do not respond to opioids such as morphine. Since pain is varied, there's no single way to think about pain. There is no gate that turns it on or off. There are many factors that increase or decrease pain. Often there is less pain just after an injury. There's an element of shock and a surge of endorphins. Then the next day, when there's swelling and bruising and a realization that you have a broken bone and can't go to school, it's much worse. The most effective way to tackle pain is to attack it on many fronts. It's like having a book of plays or plans. The 4 main targets to attack are listed on the slide. When you use medicine, rubbing, ice, elevation, and positioning, you are targeting the body and tissues. When you focus on the mind, you use relaxation, controlled breathing, and other techniques. You can change the body chemistry, but you also decrease the perception and transmission of pain. When our energy is low and our interactions with friends and family is limited or stressful, this takes energy away from helping with pain. Therefore, connecting with your church community and making sure there are pleasurable events in your life will help pain. Targeting all of these areas is called a multimodal approach to pain. Let's ask a question now.
All right, so I'm going to launch the poll question for our audience now. And the question is, how often does your child experience pain related to a bleeding disorder? And your options are daily, weekly, or monthly. So we'll give you guys about 30 seconds to answer that poll. About 5 more seconds. All right. And Sandra and Julie, it looks like about 75% of our audience says that they experience pain monthly, and then equal amounts daily and weekly at 13% of our audience.
Okay. So when looking about pain, children who are feeling or experiencing monthly, one of the things that's a long-term type of pain, it might not be chronic, it might be acute in nature, but it's something that they have to face over and over. And so it will be important to target that emotional or that mind aspects of pain so that the kids, the quality of their life can be maintained in a positive manner. Okay. As I said earlier, we're going to focus mostly on procedural pain. Children with bleeding disorders are faced with repeated tests and medication administration. These require a needle stick either in a vein or in a port. Children and adults all have immunizations, and in our hospital there are over 250,000 immunizations a year. We say that's a lot of pokes. There are high levels of pain and distress when these pokes and procedures are done, and some of us end up with needle phobia. Children, parents, and healthcare workers all have high levels of stress, especially when a child is fearful, anxious, and unable to cope. Procedures are often considered worse than the main diagnosis or health problem. The child's thoughts about procedures are often related to a previous experience, their state of anxiety and worry, and the preparation that they received. My daughter at age 3 needed an eye exam. The administration of eye drops did not go well, and as a result, she had an extreme fear of male doctors for the next 4 years. I needed to find female health providers. Poor procedural pain management is often related to communication, lack of input, individualization, and then not waiting for a medication to work once it's been given. There are specific activities that can improve the experience with procedures. First, we need to realize that a procedure is a biophysical and psychological experience. An individualized plan that includes non-drug interventions as well as drugs if necessary should be developed. A procedure should be stopped for evaluation if anxiety is high and not managed. Let's have another question.
All right, so we'll launch this poll. And this question is, how many needle sticks does your child have in 1 month? And your options are none, 1 to 3, 4 to 8, 9 to 15, or 16 to 30. And again, we'll give about 30 seconds to allow the audience to vote. With about 5 more seconds. And pretty even here, ladies. We have 1 to 3 pokes per month for 14% of our audience. And then the remainder of our audience at 29% each for 4 to 8, 9 to 15, and 16 to 30.
So this is Sandy. So looking at those results, I would say there's a whole lot of pokes in this small audience. So when you think of all the children that have bleeding disorders and children that interact with the healthcare system, we really need to look at what procedures do and the experience that these children have with those procedures. So as we talk about procedures, while they may cause pain, anxiety definitely makes that pain bigger. The anxiety establishes the experience as being more painful than it really is, and the next procedure becomes worse, and the next procedure becomes even worse. This results in a terrified child, or even adult into adult life, who becomes terrified of having an injection or giving blood. Julie and I led an interdisciplinary group at our hospital, and we searched the literature to find out what would work for children undergoing procedures. Here's the listing of the categories that we found, and we'll be sharing some tips with you. Julie's going to continue as we talk about preparation, positioning, and other topics.
Thank you, Sandy. As Sandy mentioned, we found from our experience, and most importantly from the patients and families we've worked with, that it's the little things that often become the big deal. And when you and your child have a chance to talk about how procedures have gone in the past and what went well, and I would suggest not doing that right before you have one, it really helps just to kind of take a step away and help you both to focus on the positive and begin to make some helpful changes. It really helps you to build skills for the next experience and to become more successful too. And whether it's sharing step-by-step or simply a door open or a curtain closed, sometimes it's the little things like privacy that can make an experience more comfortable for a child, and as Sandy mentioned, that contributes to the pain effect and how much that is. So we're going to talk for the next few minutes about how simple things like a touch, your touch, a warm blanket to warm up the veins before a poke can really be helpful. Often we've found that the number of people can be overwhelming for you or for your child, and this is your chance to help make an experience more comfortable. So you can ask, you have a right to ask to limit this number, and that can be an important step towards advocating for your child or your teen's comfort. Lastly, our words really do make a difference, and we're going to talk about how to prepare with comfort and care. So the next thing I'm going to talk about is remembering that you know your child the very best. So the simple, honest explanations like we're going to clean your arm with a tiny washcloth, or a needle is like a small straw that connects to the syringe to show the doctors how your blood is working for you. These are all some things, and there's some tips on this slide about just practicing and simple explanations, and that pictures can really be helpful. You can actually create your own picture storybook about different things that you can take along for future experiences, and that often really helps. For best word tips, we find that there are some tips that parents and providers have used to help many kids to focus on what is helpful, and these words help them to become more confident. When we use words which are helpful, we can help that child to build bridges and to build trust. And when you build trust, things always seem to go better. Remembering how when we've done something the first time, or we've done it multiple times, or we're in a new setting, sometimes things can get out of control a little bit. And we have found that that whispering also really helps to bring the anxiety level down, because everybody wants to hear what we're whispering about. So it tends to bring that focus to the whispering and sort of the quiet voice, and to help that child feel more out of control. We also find that when we want to avoid telling a child how something will feel, remembering that we may feel something, even a well-meaning parent can, I've done this before, remember, how that we don't have that experience and that true understanding of how our child is really feeling. So we have found that just moving on and just asking the child how they are dealing with it, and that becomes more helpful. Also, when we look at common medical terms, the quote at the bottom, they're often commonplace to staff or even to adults, but however not always to our families. So you can ask to have things defined. And this next slide really speaks to that. This is from an article that one of the many that we read that really shows how some basic medical expressions can be confusing for kids. For example, when we say drawing blood, kids may wonder where the crayons are, rather than saying blood test, which then can further clarify that our blood can tell doctors and nurses a lot about how we're feeling. And an IV, not poison IV, as the child may think, but really reinforcing that it's a small tube or a straw in your arm or hand, and reinforcing that the needle doesn't stay in but is removed. And we have found that a lot of adults have that misperception, that only a plastic straw remains. And kids are really also helped, we've found, and I found in my experience with working with many kids before preparing for surgery and other inpatient stays or outpatient visits, that when you see the actual item, so sometimes I'll even take like a small specimen cup or a little medicine cup and actually show the child the individual, that very small, tiny little plastic catheter. And we learn about, wow, how small it is and how flexible it is, and we learn about the science of medicine. And for kids, that is, especially for kids that are learning about science in their bodies in schools, it really does help. So when we look specifically at bleeding disorders and preparation and best words, again, you know your kids the very best, so you can tweak these statements to work for you. But when you ask, what are some ways that I can help you get ready? If you're asking, it helps your child to know that you're a team with them, that you want to prepare them, and help them experience success. So when you have these word choices, you're helping your teen or your child to become really more self-aware and build skills for the future. For example, think about some of those things that you were doing for the first time, or tell me about what you know about your procedure and what makes it easier for you to take medicine. And again, when we practice these things when we're not in the heat of an experience, it's always way better. We're going to move on to comfort positioning now. Comfort positions really make it easier for all. A lot of the literature that we read really supported the evidence to this fact that when we are sitting up, we feel more in control. Once a child, normal development, can sit up at 6 months of age, they become less fearful than being in a supine or laying down position. And they feel, even more comfortable when, they're being held and supportively and safely held. So you might need to ask your provider for the use of comfort positions, and we're going to show some pictures of those. In this next slide, you'll see this was a poster that was developed at our hospital in concert and collaboration with patients, families, and with providers. And what we've found is the procedures listed are the ones that work the very best for a back-to-chest bear hug, for the IV and a blood draw injection. You can even see in the left graphic that they're utilizing the table to add to that support, and the parent has their legs around that child. They're sitting up. They're feeling much more comfortable, as you can see in the pictures. Again, the child leaning into her mother and on the right-hand side. And even some things like you may, at the very bottom, the frog hold may not be needing a catheter or a pelvic exam, but you can actually sit up on a table and do some distraction support. Trying new methods for, positioning patients really sometimes, it requires that clinical staff to step out of their comfort zone, so it becomes really valuable for the child to assess what is the best positioning with input from you all and what's worked in the past. Distraction is a powerful and amazing tool. We just really utilize it a lot. We have found that when you use it to help your child reframe an experience before it happens, as well as during the actual procedure, and then afterwards, you can and will decrease the memory of that negative experience, if there is one, and also help that child to build confidence. We find that distraction items really need to be engaging, and so engaging that they overtake the experience and draw that child's attention in. So we've utilized things like bubbles, and think about it when you blow bubbles indoors. It's always like, wow, I never expected to see those, inside a building. So really engaging something that child, and we are in the age of social technology and just an amazing resources here and there. So we have found over and over that utilizing it before and during and after really does help to speed the recovery and help us move forward and build trust again. Here's some tips for some developmentally appropriate distraction supports. For infants and toddlers, we found that sensory things, baby swaddling, and that would mean, just cuddling and comforting your child, utilizing a pacifier, as well as we found some really cool beneficial sound machines. So there's infant sound machines with, kind of baby sounds, heartbeats, as well as waterfalls, ocean sounds that can be utilized for a variety of ages. But we have found those to be very, very helpful. And you, again, know what your kids are most drawn to, but it's helpful to have a small bag of these items that you can just take for medical appointments. Then they will be surprising and exciting when you get there, as well, as opposed to using them every day. So again, we have a picture of a bubble light machine that we've found really is helpful. Lots of hospitals are starting to purchase these and have them available, and often may have a relaxation area in their hospital, which is kind of cool. The spinny light on the corner picture is also a real light up, toy. There are a lot of things available online if you just search for distraction items. For the school agers, as I mentioned earlier about the science of what we're doing and procedures and things like that at the hospital, they're also very keen on the rules. What are the rules? What are some things that are going to make it, what can I make up to help myself feel a little bit more in control? Can I say that I want to count to 3? Can I say that I want to see, things step by step and know exactly? I want to watch or not watch. Or I want to have some choices. I Spy is viewed in the picture to the left, and that really is a tool that we have found over and over is really beneficial to be able to search for something, and it helps us to concentrate. For teenagers, and again, I have 3 of these wonderful people, and I just have found over and over, if you utilize things like a smartphone or things like a video game, or tell me about what is going to work for you, individualizing that and making it about their choices. Sandy had mentioned about the gate control theory, that also works very well if you're rubbing another part of their body, because that becomes then the focus. So I've done many a foot massage, and I think those are, again, a real surprise and delight, and, especially for kids that are feeling that need to have some touch, and how that helps. Here's some self-help activities that kids can even do on their own, as you see the infant and toddler doing peekaboo. Those are really some great games and some things that you can do even if you don't have anything in your pocket. You can use yourself, and you are a very powerful tool of distraction. Words of focus and framing that experience, even the sights and sounds, talking about how that will feel, or the length of time something will be. That really just provides the initial steps for development as we move along in our individual coping skills and setting those up. Here's some self-help relaxation. Deep breathing is an amazing tool. It really will help you, I think, as a parent at the bedside, as well as you will be surprised that, as you start utilizing these skills, even the providers are going to go, oh, thanks for doing the deep breathing with me, because I was really nervous about this, or I wanted to help you along the way, and it really calms. It also causes that child to become more aware of their breathing, and to be able to focus on something. If you take a deep breath in through your nose and out through your mouth, if you even kind of ask to lower the lights, or to have something going on, and practicing with your child is really, really effective. We also find that visualization in your mind's eye, if you think about your favorite places and some trips that you may have taken, or an experience that you had, or even a funny story, that if you can recall some of these actually and involve your child along with you, that helps them to think again about the distraction or the stimulus of what you're having them talk about, as opposed to something, focusing on something that might be scary, or might be painful, or might be something that they're a little worried about. So we find that those key surprises, and key messages coming back to these, the surprise and delight really can change that experience. It can help you to build engagement if you change it from a negative experience to a more positive and comfortable one. And, again, as I mentioned, those funny inside jokes, and even a fart machine at just the right moment can be something that really is helpful. So we are now going to be moving on to drugs and devices, and I'm going to be turning that over to Sandy.
So when we talk about drugs and devices, we're really focusing on that body part, or that target for decreasing pain. Some procedures are very painful, and they will need, sedation medications, or opioids and analgesics. So we need to really consider those if that procedure is going to be painful. We're not going into that. We're going to just talk about maybe a few things that we can use for needle sticks, or port access, or medication administration. And when you look at the top part of this slide, there's a staple coolant spray. And this spray is it's a cold spray. It numbs the very top layer of the skin, but it doesn't go deeper into the tissue. So it really wouldn't be good for an injection that had a lot of fluid and was painful as it was injected into the deeper part of the muscle. There's also a risk that if you spray too long, you can have like a frostbite on the skin. So it needs to be provided in a very short amount of time, and by people who are cautious about the amount to spray. Topical anesthetics are the local anesthetics that can be applied to the skin. There's one a few years ago that had to stay on the skin 60 minutes before it worked, but the new products, which can be purchased over the counter, are called LMX4 and LMX5, You have to keep them on the tissue at least 20 minutes. And these provide numbing deep into the tissues, and they even say that leaving it on for 20 to 40 minutes, you can cut the skin, and you can also take skin biopsies. The J-tip is sort of a new device that injects the local anesthetic with some air into the skin. It has a loud pop, and many emergency rooms use that because you can get the topical anesthetic into the child quickly without waiting the 20 minutes. The loud pop can be scary. Intradermal injections is taking a small needle like a butterfly needle and injecting a small amount of lidocaine or a normal saline around where you might start an IV. Some people argue that you're going to have 2 pokes, but I know that from my personal experience and others that having a little poke with a butterfly is often more comfortable than the poke associated with a large needle when you're trying to start an IV. Just to mention that breastfeeding of sucrose, which is concentrated, sugar, is a pain-relieving drug. It's sort of for small babies, infants 6 months and younger. And so those of you that have a child that needs a procedure at a young age, think about using these as just something prior to an injection or an immunization. Julie mentioned about rubbing and touching, and so this is a device, or I call it a drug. It's tactile stimulation, and what it does is a powerful tool like distraction. It stimulates the large nerves, and it can tackle pain. First, you can have tactile stimulation with touch, ice, or firm pressure on the skin, and so that pressure competes with the pain message being sent by nerves. So use a steady pressure or a firm rub, and think about stimulating that area between the brain and the pain, or on the opposite side of where the pain is occurring, because then that will have a decrease in the perception of pain. So that brings us to Buzzy, and I don't know how many of you have used Buzzy, but we've discovered Buzzy, and Buzzy was developed by a physician who works in the emergency room. And Buzzy works on the science of gate control, where there's vibration and cold that helps shut the gate on the small nerve fibers that send sharp pain messages to the brain. So it alters not only the transduction, but also that transmission. And then if you add distraction to that, which is a target to the mind, that you use, it inhibits the control that the brain is, and it sends a trigger to stop the pain signals. So that outcome, using both a focus or a target to the body and to the mind, is that the pain message feels like it's less pain. So Buzzy works. In the slide here has a website where you can buy Buzzy, and the website also has a lot of information about pain sensation and instruction of how to use Buzzy. Buzzy can be used for as little as 20 seconds with a cold pack, and it really decreases like a finger stick, blood test draw. I think it also helps with immunizations. It talks about taking splinters out and all sorts of small minor procedures. In fact, Julie and I signed it out, Buzzy out, to our friends and family. And a nurse I worked with yesterday signed it out for her 20-year-old son that needed to have an immunization. So even adults have found this to be useful. Just a tip is that if you find Buzzy, the big part of Buzzy, which is the bottom part, needs to be towards the hand, and the little part of Buzzy, or his head, needs to be towards the head of the patient. We have Buzzy available in our pharmacy, and so some parents have bought it and bring Buzzy to their appointments. So now that Julie and I have given you some tips and tricks, now let's talk a little bit about what you need to do to be a coach. First of all, I think we said you need to share the information about your child's experience, whether that's been a good experience or an experience with anxiety and fear, because those will influence the current procedures that you face, and to form a partnership with the provider that's going to provide that procedure. Tell that provider what works, tell them what doesn't work. By telling and talking about that experience, you demonstrate to your child how to advocate for themselves and how they might need to do that in another setting. Ask your child what works or make a suggestion of what to try, and then teach that skill. Practice that skill, especially if you need to practice it over from an old trick, or as you add new tricks and techniques, then you need to practice that also. As Julie highlighted, preparation of the child is important, but you as the coach also need to be prepared. If you're anxious and fearful, your child will sense that. If you need to step away because it's very anxiety producing for you, ask for help and do that. You can tell your child that you too are learning about how to handle this procedure and that you can learn tips and techniques together. As a coach, identifying the specific skills that your child can use is important. It would be better to tell a child that they did a good job sliding into second base instead of saying just good game. This specific feedback is called positive recognition. Michael Brandywine came to our hospital to talk about how to raise strong children. And I think positive recognition was one thing that Julie and I both took away about what we can do in a small way to really teach children about coping skills and tell them what they're doing well and how they're helping us. So by recognizing very specific accomplishment, you reinforce those behaviors. Tell your child what went well with the procedure, like holding still, taking deep breaths, asking good questions. Ask the child what they think went well and what needs to change or what they need to do next time. So when you look at key messages from positive recognition, these are some of the phrases that you might want to use or change depending on what you see your child has done well, but kind of think about being very specific in identifying what they've done well and what you might work on next. I think we have some polling questions now.
Mm-hmm.
Yes, so let's do this next question. Give me just a second to launch it. Okay, which techniques have you used to help your child with pain and anxiety? The selections are preparation, deep breathing or blowing bubbles, an application on a phone or tablet or using music, numbing medications, or tactile stimulation like a buzzy. And we'll give everybody a few minutes or a few seconds here to vote. And 5 more seconds. Okay. And 43% of our audience has used numbing medication. 29% has used an app on a phone or tablet or music. And then 14% have used deep breathing, blowing bubbles, and preparation.
Okay. All right. So those are all great, things. I think that utilizing the numbing medicine, it sounds like, many of you have tried that, and I know that does work really well. I think that one of the things that we found as you add more, tools and tricks to your bag of skills, I think that some of those breathing, it'll be interesting for you to try and sort of see what some of those things are that work particularly for your child. What we found too with the numbing medicine is that it often works as a placebo effect, that kids really find that, okay, I can do it with that, and then they graduate, and it'll be interesting to see if any of you have tried Buzzy to see if that makes a difference as well.
And just to go back, remember the slide about this, Sandy, on Buzzy, there was a little girl holding a Buzzy, and she actually had a port, and sometimes toddlers don't like that Buzzy on their body, and she was intrigued with that Buzzy and holding it that they were able to access her port without any numbing medicine or waiting the 20 minutes. And the mother chose that because it sped up the whole interaction of getting blood for her test. So as Julie said, I think as your toolkit becomes fuller of tricks or your playbook has more plays in, you'll find that you'll be able to adapt to different situations given targets and all the parts to make a good pain plan.
Mm-hmm. Yeah,
and ladies, just to chime in, 2 of our participants let me know that they have actually used multiple of those techniques,
yes,
and one of them did speak up and say that they've used the Buzzy.
Great. Oh, good. That's awesome. That's wonderful. And there are some wonderful online, just, I'm sure as you kind of search around, there's some great apps that are available for phones that that are just online, and you can Google that and find out some other new tricks for the sharing the wealth is always a great thing. So thanks for sharing those answers with us. So the next strategy that can be really, really effective is called One Voice. And we have found this works really well. We've tried it and utilized it at our hospital over and over. And when this is decided with your providers ahead of time, it really helps things to be more in control and to go more smoothly. It also helps your child to know who to focus on, and we find sometimes that if we're in a procedure and things are, there's lots of people involved, it's hard to focus unless there is that one voice. When everyone is talking at once, it becomes confusing for everyone. This also helps to build successes for the future. So we have found that when we ask before the procedure starts, again, this is another, as Sandy mentioned, your role in terms of advocating, it really does help to ask for this in advance when that person, was talking and then following up at the end. You really listened well. You used your eyes to focus on the I Spy book, so we could work together. That really helps to, again, build those behaviors and support to have the child focus and then be a part of the distraction. Again, you can also try the whisper technique in this, the calm, quiet manner if things get a little busy and out of control. So all of these things really move and are founded on the principles of patient family-centered care. These are simple concepts that really make a difference. When information is shared in a respectful way and in a supportive way, we begin to partner together to help you as a family to feel like you are sharing your ideas and your experience, which again leads to a stronger child with more self-confidence and feeling empowered and in control rather than feeling anxious and out of control. So we have found we utilize what we call the POKE plan, and we find that that is beginning to give, and it does give a voice and a choice to the child, but also to your family. And this is a picture of how we have it displayed at our hospital outside the door for all to see that that is a plan that works for that particular child, and there are elements that are unique to them and their experience regarding distraction and positioning. So we find that when we can make a plan, one of the first steps, as Sandy mentioned, about talking about creating a plan, thinking about what works for you or what works for your child, and identify any of these past experiences, whether they're good or bad, and just what positioning, what distraction items are helpful, whether they like blowing bubbles or they want to have you holding their hand. Maybe you need an additional person if your hospital or your doctor's office even has a child life specialist or someone that can support and be a coach to help along the way that your child is going to build a trust as part of that experience. You make a list and you make a plan for the next time, and then what you do is you keep on communicating and reevaluating to see just what works the very best. And again, when you communicate about things, talking about it, teaches your child to advocate for themselves as part. So you, in this picture, you'll see the elements of how it works here at the University of Michigan, the POKE and procedure plan. And we have three versions of this. The paper version is one that you have received as a handout as part of this webinar. And all of the elements are listed there. The passport is simply a smaller version that we have found that we give to patients and families when they leave a setting. They can take it, they can keep it in their wallet, and they can use it as a reference. And then we also have electronic medical records here at our hospital, and the electronic version is able to be changed. It's online, and it's also modified depending upon that individual child. All of them are modified, but this is something that, again, captures their voice and their choice. We even had a 6-year-old who successfully created a poke plan for a surgery preparation who said it was his favorite part of the whole entire experience, and 6 months later he took his poke plan to the dentist where he was going to have a cavity filled. So you can use it. It really gets all of us on the same page, the patient, the family, and provider, and it provides that framework for next time, which we have found to be very helpful. So we're coming up to another polling question, and so this is our next question for you to answer.
All right. So the question is, have you ever written a plan to take to the doctor or the emergency room so the staff know what works for your child when they have a procedure? And yes or no? We'll give the audience about 5 more seconds here. And 100% of our audience has not written a plan before. So this is exciting news, ladies. They have that plan in their email right now.
Well, you are in for, I'm really excited for you guys to learn about this strategy then, because we have found that this really causes clinicians of all levels and varieties to stop. And we have a situation that I wanted to share with you. We had a child who was going in for an MRI, and it was going to be under sedation, so the anesthesiologist and all of the technicians were available and there in the room getting ready. The mother was going along with the patient into the procedure room to start the induction process, and this child stopped everyone in the room and said, "Wait, I have a poke plan." And so he stopped, and everyone stopped and said, "What does your poke plan say?" And he said, "I like to count." And so they counted, and they counted to 3, and the mother leaned over to the anesthesiologist and said that was the fastest to 3 we ever got. But that whole experience of really having that child have a voice, have a choice, and that procedure went so smoothly because they stopped and listened. So I really would encourage you to utilize a plan. Even if you don't have that official poke plan, you can make one, and that becomes your child's rules and experience for that setting. And it also helps you to have a plan and feel more confident. So if and when you go into an emergent setting or into a procedure, you have some history about your child and experience right at the ready. So we have found that, just as a review, that when you prepare before a procedure, and we all know that things, when we have prepared and asked what has worked before, it just really helps us to avoid that unknowing and that worry about not being sure. So making a plan, again, gives that voice and a choice. It helps for you to be a coach, to hold hand, to choose a distraction item, and to suggest what drug maybe, whether it's that numbing cream or utilizing a Buzzy, that what works for you, and that you have some opportunity to work as a team and communicate and develop one voice and evaluate and revise a plan. And then, as we all want to know what went well, we can give that recognition to the child and the coach and to one another. And it becomes a win-win-win for you and your child and your healthcare team. So we're coming up for our last polling question of the evening.
Okay, and that question is, how comfortable is your child in telling staff what works best for them during a procedure? And the options are not comfortable, somewhat comfortable, comfortable, and very comfortable. So we'll give you guys a few minutes or a few seconds to vote on that. We'll do 5 more seconds. And about half of our audience feels that their child is somewhat comfortable, with the remainder of the audience being equally split amongst our other 4 choices, ladies.
Okay, all right. And that's a great opportunity for you as they're starting to feel a little bit, comfortable, or maybe not at all, that you can help build those skills as a parent in supporting your child to help them learn what are some things that they can do in the situation to have a little bit more control or to have a little bit more comfort in that procedure. So there's lots of opportunity for you to be able to do that. And I think just thinking about some of the things that we talked about tonight, step by step, writing some of these things down, and then writing some things down that, are things that your child really likes. I mean, even asking them, hey, what are your favorite things? What are your favorite stories? Just keeping a list of those available and at the ready will also be some ways that you can help build those skills. So we have a few minutes that we could certainly entertain some questions if you have any and would like to.
So I will go ahead and chime in here that we've had a couple of comments from our participants. And for all the participants, in your control panel on the right-hand side of your screen, there's a questions area where you can type in questions, and I will be happy to relay those to our speakers. But a couple of comments that have come in during the course of the webinar, ladies. First of all, much excitement about the POPE plan and having that written plan and giving the child some control in the situation. One mom was very, very excited about that opportunity. But 2 other moms said that they used, and I'm going to probably pronounce this wrong, a Sandra patch, S-Y-N-E-R-A patch, as a distraction technique and a magic glove technique. And I was wondering, Sandy and Julie, if you have any comments on that, and maybe can describe those for us.
Yeah, so I can comment about the magic glove technique. That is a wonderful distraction technique, and actually it's very powerful, and what you can do is, again, in your mind's eye, you can actually use a glove, and you can actually physically put that on the child and talk about warming it and taking, each step and finger, and it's a gradual relaxation technique. You can also put on an imaginary glove if you don't have one handy, and you can utilize that. And again, that becomes that building, that connection. It really is very effective when you couple it with deep breathing and sometimes some relaxation music in the background. It's all like lowering the lights. It's all a progressive muscle relaxation technique as well. That's another technique that you can utilize. But that magic glove, that's a great idea. So I hadn't put that in our suggestions tonight, but that's a great one.
I think the magic glove works really well if you're going to start an IV on a hand, because I saw a child actually, in their mind make that magic glove take all the way away the pain, and when they took away the glove, there was no pain. I think the magic glove can also be like a magic wand. So the magic glove makes the hand magic, and the hand can go to where it hurts and wave it over to make the hurt better, because Julie gave me a magic wand, and a magic wand really helps to take the pain away or the fear away, because then, I become magical. Sandra is a patch with a local anesthetic, and it has an element of warming or heat in it, so it moves that local anesthetic into the tissues. I know that at one time price was an issue on some for our hospital when you think about providing it for immunizations, but I think any of those patches or J-tip or numbing medicine is important for a child who has a repeated injections, has high needle phobia, has high anxiety. I think sometimes it's difficult to get that as you move between settings or going on vacation. So I say keep your toolkit full of lots of things to try.
Mm-hmm. Definitely.
And the mom that has used that patch in the past just followed up and said that she believes that it just got approved for home use. So that might be something for our participants to look into. and the mom that had used the magic glove technique also followed up and said that there is a free lesson online. So I'd encourage anyone that's interested in that to maybe just Google that term and see what.
Thank her for us, because I like to know research.
Yeah, that's great to know the resources out there. Wonderful. Yeah.
And then another mom pointed out that they bring their favorite tourniquet to the emergency room for use.
Cool. Is it decorated?
So I don't know. I'll have to see if she answers us. But it reminds me of my own son, and he had a dog. He had a stuffed dog that still to this day, 11 years later, goes with us to every doctor's office visit and every emergency room visit. So it's kind of like that comfort item, even if it is a medical item. It brings a sense of comfort and control, I believe. Mm-hmm. And the mom with the patch said they just started using it last month.
That's great. Well, another thought that came to mind when you mentioned about the comfort items is something that we've done at our hospital is to acknowledge some of the journeys that that your kids are taking in you. And so I don't know if this is an option, but you could certainly start creating that yourself. We have a program here called Hope Beads, and it acknowledges every step, every procedure, a child, every hospital stay. They get a bead to add to their necklace or their keychain, and they create an acknowledgement. Now, for some kids, that doesn't make a difference, but for others, it really becomes a part of their journey, and it really helps them to acknowledge, I'm not alone, I'm doing this, and I'm really making strides, and I'm moving forward, and I'm helping myself and building my skills along the way. So that might be something that that you could also add to your bag of tricks and experience.
Yeah. A mom just added that whenever her son has a bleed, she wraps his stuffed animal with Coban. So if her son has an arm bleed, then his friend also has an arm bleed. So I think that's really
great.
Another question.
This is Sandy, and I want to say that she's targeting that social and psychological target of having a companion with you as your, the journey of pain, that the animals with you, so that she's really strengthening that target of pain and anxiety in a different way other than, the body. So good job.
All right. Another question that just came in is, what articles, research findings have there been regarding this issue and children's developing PTSD?
Oh, yeah. You mean in terms of the anxiety and developing phobias?
Yeah.
Well, I know that, over time there definitely is anxiety. If it's not addressed, it can move towards that PTSD, certainly. But I don't know any specific articles at the moment.
The only article I know is that there was some research done on children with cancer who had bone marrow, tests, and they found that if the first procedures didn't go well, that the subsequent procedures did poorly and more poorly, depending on how you handled it. So I think a lot of times if you can get the first procedure to go well, then the others become better because you learn from those experiences. If it hasn't gone well and there's really that fear, I think it's a time for a parent to say, I want to have a plan, and that you might use medication and other things at first with the goal of eventually not needing it, because you probably need to be able to go through some procedures without always going to sleep, etc. So I think it's important that when you start on a procedure or a long-term illness where you have these procedures, that you look at the plan to make those be successful over time.
And we also have listed our website, the POC plan on our website, and we have some references for you. And I would just draw your attention to the references at the end of the presentation. We've drawn for a lot over the years from the work of Lindsay Cohen and behavioral approaches to anxiety and pain management, and he specifically targets pediatric venous access. There's also the impact of positioning on fear during immunization by the work of Lacey et al. And I think, and Schechter, over over time, the pain reduction. So all of this is, there is, documentation in the literature, and I just encourage you, I think it does help you in terms of advocating for your child to know some of these references as well.
And just to our participants, if you're interested in having a list of these references emailed to you, just email me, Sandra Wilkes, at HFA. You should have an email from me already in your email earlier today. So you could just reply to that. And if you want these list of references, I'll be happy to pass this list of references along to anyone who might need them. So unless we have any other questions, and I don't see any more in our questions box right now, I'll ask Sandy and Julie to go on to that very last slide for me. And begin wrapping up our time together tonight. I want to thank Julie and Sandy for a fantastic presentation. I think it's going to be really helpful to a lot of parents and getting through some of those really difficult years of learning how to poke for bleeds. As those of us that are raising a child with hemophilia, we know that we have to infuse, and that involves a poke at this point in time. And sometimes that goes easily, and sometimes it doesn't. So thank you to Sandy and Julie for their time developing this presentation, for all of the work you've done over the years in this area, and really appreciate it. Thank you to everyone for attending tonight. I know it's hard. It's a tough time of night, and especially as we are beginning back to school season, I know it's a tough time. Speaking of, if you are needing some assistance with back to school, again, let me know. We've got some great resources at HFA in our back to school toolkit that can help you plan out some IEPs and 504s and just making that school transition a little bit easier for you this year. So with that, I will wrap it up for the evening and say thank you to each of you, and good night. Good luck in everything that you do here in the future.
Good night.
Thank you. Good night.